The Emini-named lectures pay tribute to some of the great minds that have changed the face of neuroscience. Experts from across the globe are invited to give talks about important issues in neuroscience, medicine, and society. The 2007 Wilder Penfield Lecture was given by Scott Johnson, president of the Myelin Repair Foundation, or MRF. Mr. Johnson has suffered from multiple sclerosis for over 30 years, and in 2002, he founded MRF with the intention of finding an effective treatment for this complex disease by focusing on the repair of myelin. Myelin is the protective sheath that surrounds neurons, and deterioration of this layer is associated with several neurological disorders. But MRF operates differently from other disease foundations, and this has attracted a lot of attention. They've designed a specialized business plan with the hopes of accelerating medical research. Critics are particularly impressed with the degree of collaboration this nonprofit organization has achieved between participating scientists, universities, and the pharmaceutical industry. In fact, many of MRF's donors are anxious to see if this model can be used in the pursuit of treatments for other complex diseases, like cancer.
Ultimately, it started because I was diagnosed with MS in 1976, which was 31 years ago. But really, the triggering event was this little thing in Business Week about the possibility of repair and MS. And so that's what set me on this course to learn more about what was emerging about myelin repair and about how academic medical research occurred, and also kind of more about the overall pharmaceutical industry in general. I assumed that there was some organization, whether it was the government or some disease foundation, had a research plan, had kind of a roadmap for this disease to figure out treatments or cures. And so it was shocking to me to realize that there was no plan, and that it was a very complex problem, and yet there weren't easy mechanisms for scientists to work closely together as a true team. That the scientific process is pretty random, and just the fact that the commercial world, which is the only entities that can actually put something through clinical trials, were relatively disassociated and didn't speak the same language or have the same culture as the academic world, which is really charged with doing all the basic research. So there were kind of several things that just seemed to me to be not the most efficient or effective way to actually end up with a treatment.
So what is it that MRF does that is so unique?
We actually have a process called the Collaborative Research Process, or CRP. We have acronyms for everything. And that's kind of how the team works together, kind of written down on paper. But the overall model is, we call it the Accelerated Research Collaboration Model. And so we convene groups of people that can actually achieve specific goals, and whether that's a group of principal investigators at universities, or whether it's convening groups of industry folks to provide guidance as to what they need in terms of research in the academic world, attaining tenure and getting papers published is absolutely critical. But what that means is, in that system, scientists, of course, have to be pretty careful with what ideas they share before they get them to a certain point or have published on them. So what we did is, when we selected our group, our principal investigators, we created what I would call a protected cocoon. And in that group, anything can be shared completely openly without any concern or fear about getting scooped.
How do you go about allowing scientists to pursue their own interests, but grabbing the stuff that you need?
That's a very good question. And I guess when it comes to basic research, you really want that to be totally random. You want it to be unfettered. You want brilliant people coming up with off-the-wall ideas, because I think if you look back through time, some of those off-the-wall ideas are where just amazing things have come later. And so I'm not advocating in any way